The floor is yours.
And thank you to all our witnesses for being with us and for doing everything that you do to keep us safe. My question is for Dr. Poirier, Mr. Poirier and Dr. Tromp. Both of you said in your remarks today, and we've heard from earlier witnesses as well, the desire to have a new look at the federal role in the healthcare paradigm. And this is, of course, difficult because healthcare and the provision of healthcare services is provincial. It's choppy waters. I think, Dr. Tromp, you talked about, I'm forgetting if it was you, but we did hear today about the need for a national healthcare human resources plan. I think you talked about securing the supply and distribution of PPE. Mr. Poirier, you even wanted to open up the Canada Health Act. I wonder if you can tell me what should the government do now to ensure that these recommendations of a more articulated federal role, what do you think the government should be doing now in order to ensure that we are ready for the next pandemic without any of these differences in power and jurisdiction getting in the way of healthcare protection for Canadians?
So if I'll start, and I'll be brief, the easier one, I think, is for the federal government to manage the NES, the National Emergency Stockpile, well. It isn't just about gurneys and bandages. It is also about pharmaceuticals and personal protective equipment. So I think there really is an important role for the federal government on the NES file. Part of that would be to ensure that the Public Health Agency of Canada is speaking with Public Safety Canada so that we do understand what our vulnerabilities and risks are and that we can adjust the stockpile to meet the needs within an all hazards approach. So I think that's the easy one to do. If anything is easy in government. The second item would be that I think it's time for us to have that dialogue. Sometimes in a disaster that presents opportunity. And I think that it really is a significant event that the number of people in long-term care and retirement facilities that have passed away, I think it is time for us to take a national look at the Canada Health Act and how we can really serve our older generation much better. And I think we deserve to start that discussion. So thanks for that. Thank you.
Dr. Tromp?
Yes. So I'll just make a comment about an issue that comes in the Society of Rural Physicians a lot. We find that doctors who especially work in northern areas of every province and other healthcare workers have much more similarity in their needs with other doctors who work in the north than with their colleagues in the south. So health is delivered on a provincial basis. So the doctors in Northern Ontario are working with the doctors in Southern Ontario, but actually the doctors in Northern Ontario have much more in common with the doctors in Northern Manitoba and the doctors in Northern Saskatchewan because their training and what they need to learn is much more. So we talk a lot about this in the Society of Rural Physicians. Now, I'm not a parliamentarian. I don't really know how the Canada Health Act is, what that is and how it affects the Constitution. But I think there are things that, like the stockpile is very important. It seems to me that if there were things that were out of date 3 years ago and weren't replaced, you just have to not let it get into your subconscious. You know, like people were saying before, you forget to change your oil, you forget to replace the battery on your smoke detector. You have to have a way of reviewing that regularly. And then I think this is a good time. We don't have all the answers, but this is a good opportunity to look at what the problems were and see how we can help with the issues that have now been identified, not having the answers yet. But I mean, another one that comes up for rural doctors is there are many rural areas that are in isolated areas of one province, but close to a tertiary care center in another province. So, for example, people in would be southeastern British Columbia or very close to Vancouver. I mean, very close to Calgary, a couple hours drive to Calgary. But if they have a sick pediatric patient, they have to send the patient to Vancouver, which is an airplane ride away and a 16-hour drive, I believe, when the parents have to drive the child home. So is there some way we could coordinate some of these things, especially at the provincial barriers, to help with that? But I don't think we have, I think what we have more is lots of questions for discussion and sorting out. I don't think we have the answers yet, but these are some of the things that we have to start discussing.